So this is my talk is about reversing cardiovascular and diabetes. And in the general session, I had to speak really fast, and I had to cover a lot of data. So I'm going to go a little slower so that you can kind of digest what's going on. So, and guys, this is actually the not the right talk, it's the other one. Do you have the other one? Do you have the other talk? There were two talks. And I'm going to show you today that many people have inflammatory changes in their arteries already. They are at risk, but they don't even know. And many people are smoking, as we heard earlier. So when should people ask me, when should I come and see you? And I say, now. So age 25 to 30 years, that's when people should go undergo their first screening here in the UAE because of the high incidence of cardiovascular disease. And children in the Arab Gulf region are more at risk of developing cardiovascular disease, sedentary lifestyle, and their genetics. So cholesterol is a major culprit, like we all know. We've talked about this throughout the conference. Hypertension, obesity, inactivity, diabetes, smoking, right? Some of these things we can change, and some we have to, be with a medical professional to help decrease these risks. Now we know the good and bad cholesterol. The good HDL is the angel, the bad LDL, not the angel, but the devil, right? So we want more HDL and less LDL. But recent studies have shown that it's not really about the HDL. We thought it was, but it's really about inflammation, targeting the LDL and the subparticles of LDL and triglyceride. Now, diabetes is the seventh leading cause of death, and the global prevalence of diabetes among adults over 18 has risen from 4.7 to 8.5 in 2014, and even much higher now. So diabetes in the UAE is 16th in diabetes prevalence. 19% of the country's population has type 2 diabetes. And think about the people with metabolic syndrome. Those are people who haven't even been diagnosed with diabetes. So we want to just take care of this diabetes because it's not a risk factor, it is heart disease. Remember, diabetes is not just a risk factor. If you are a metabolic syndrome or diabetic, you have heart disease. And that means there's a lot of sugar in the blood, it's very sticky, and that causes plaque production because of oxidative stress. So adults with diabetes are 2 to 4 times more likely to have cardiovascular disease than those without diabetes. We had a great slide from one of the presenters in the physician section, showing that the diabetic patient who's treated has actually the same risk as a non-diabetic patient who's not treated. So you can't get the diabetic risk down to where we need it just by medications alone. There are other things that we have to tackle. Complications of diabetes and diabetic retinopathy. So if you want to see your grandchildren, you need to control your diabetes because you won't be able to see them. Insulin resistance, metabolic syndrome, visceral fat. Okay, this slide, I love this slide because I know a lot of people like this slide, right? Where the buttons are popping off. It's not good. We need to fix it. Now, what happens to the liver? You heard of fatty liver, right? So the liver histology shows high fat control and a high fat neutral fiber, which is adding fiber to the diet. We can see that adding fiber actually helps fatty liver. So when you see your doctor and they tell you you have fatty liver, think you need to increase your fiber immediately. Same thing, the lipid deposition in the skeletal muscle. Again, high fat control diet shown in the middle slide, showing lots of fat globules. And then with the diet of fiber, decreasing those fat globules. So very important, diet is very important for diabetes and fatty liver. So prevention is better than cure. I love prevention. So my clinic in King's College is going to be prevention and reversal of heart disease and diabetes. It's going to be amazing. I'm so excited. But compliance with medication is so important, and it's hard to get people to do what you tell them in the patient exam room, right, docs? Right? You say, you need to do this, and they say, okay, no problem, bye. And then they're eating their baklava or whatever. Connect all these things. So prevention is better than cure. So let's talk about John. He's 47 and he's a special forces agent, okay? And 47-year-old male, special forces soldier, sporadic reported left chest pain and shoulder pain. And he's been having intermittent chest discomfort since 2005. Didn't really think anything about it. Then came to the clinic and he had a history of comorbid with injuries, a left clavicular fracture. And so people thought, okay, this pain is probably from his being a Secret Service agent. And he had a stress test and it was negative, and he had some scores, Framingham score, ACC, AHA score. They were all normal with regard to risk of having a heart attack. He had something called a CIMT, which is carotid intermedial thickness testing, and that showed non-obstructive, non-calcified plaque in the carotid arteries. Often we'll screen the carotid arteries to look for atherosclerotic plaque, which kind of equates, is equivalent to the coronary arteries. But he had non-calcified, non-obstructive plaque. He had an ultrasound of his heart, so we have ultrasound lead technician here, and so we know that looks at the heart function. It was good, it was normal. And then he had something called the pulse cardiac test, so that's what I want to talk about. But that's something that some people in the UAE have heard about, but many have not. So the pulse cardiac test was done, it's a blood test, so it's simple. You just get your blood test done, and it looks at 9 different markers of inflammation that is occurring at the endothelium or the lining of the artery. So this is where your money should be in your head. This is put your money where your mouth is. That's the gold standard now of looking at inflammatory changes in the artery that can lead towards an untoward event like heart attack or stroke. So his pulse score was elevated. It measures fast ligand, interleukins, MCPs, for those of you who know about inflammatory markers. And it's tested through the clinic and out of California. So the pulse score is elevated at 8.07. That's a high risk for having heart attack or stroke. His risk should be 1.5, right? So here's Mr. Macho Soldier having some weird chest pain and is high risk. So again, his other tests didn't show it. And he had a CTA of the coronary, and the coronaries had plaque, non-obstructive plaque, and they did the CAT scan of the LAD. So he has plaque almost of significance, but then when they did FFR, or fractional flow reserve. So anybody familiar with FFR? It's a special technique to see if there's plaque in there and we can't really detect how much there is. We put a wire. A CAT scan is a virtual wire, basically. They can measure fractional flow reserve. So his FFR was low. The patient, he started on aggressive medical therapy. He was scheduled for a heart cath, but he didn't want to do it right away. He wanted to wait until a few days afterward because he didn't have any symptoms. He said, "Doc, I'm not having any symptoms now. I'm good. Let me go enjoy my weekend." So he delayed the initiation even of his medical therapy because he felt fine. And so after 48 hours, he ended up in the coronary ICU. He was having chest pain, diaphoresis. He was playing video games. Just video games, right down excited about something. And his wife called EMS, and we had the EKG. We could see his anterior MI elevation, classic. So he had ruptured that non-obstructive plaque. Why? Because he had all that inflammation, inflammatory changes at the non-obstructive lesion that they see on the cardiac cath. So he had an ST elevation, myocardial infarction. His ejection fraction was low now because his heart had been damaged because he had waited too long. So he was already having something happen. He didn't have symptoms. Remember, 50% of coronary disease, or 50% of sudden death, 50% of coronary disease patients present with sudden death because they don't feel any symptoms even, right? So we need to be very aggressively doing pulse testing here in the UAE because so many patients are at risk because there's so much diabetes, so much smoking, and high blood pressure. So he had PCI, that means percutaneous coronary intervention. So they fixed that vessel. I don't have a pointer, but on the top slide is the before slide. So there's a vessel missing basically because it had thrombosed up. And on the bottom slide, there's a large vessel that's called the left anterior descending artery, and it's wide open. So this man was saved, and remember he's very young. So again, cardiac MRI showing what happened to his ventricle, that it had become damaged. So this is the real heart of the matter here about free radical formation. So we are constantly being oxidized. I told my Emirates flight attendants, I said, ladies and gentlemen, you you all are being oxidized every time that you fly at 30,000 feet because we are having damage, just like ionizing radiation or UV light or certain types of energy, all damaging our mitochondria, mutating our DNA, can lead to bad things like cancer, bad things like atherosclerosis, vascular disease, premature aging. So we have to understand that free radicals are formed, and we don't get enough antioxidants from our foods that we eat. So we need to know, yeah, we don't. I know she's like, why did I eat my salad today? Right? So we have to eat well, but we don't get enough. So I'm going to talk about how can we increase our ability to stop oxidative stress, all right? So glutathione is #1 key in that. Alpha-lipoic acid, CoQ10, superoxide dismutase, a big player in that. So we'll talk about how do we go beyond just eating our fruits and vegetables because it's not enough. Oxidative stress with low glutathione levels associated with over 75 diseases. So I have patients in my cardiology clinic in the US. For 20 years I've been seeing patients. So they come with all these other things. They're not just a heart walking around, right? And they have rheumatologic disorders or Alzheimer's or Crohn's disease, inflammatory bowel disease, ulcerative colitis, liver diseases, all these things associated with oxidation. Remember, oxygen-free radicals are formed in our body every day, affecting the blood, and the blood goes everywhere. So we can have organ damage in multiple regions. So we want to make sure that we prevent all of these things if we can, if we're educated. So how can we do it? By detoxifying and removing the toxins. Okay, here we go. So we have to remove the foreign compounds from the body. Foreign compounds are from all those things that you saw. Ends up in oxygen-free radicals. And glutathione is the detoxification process that is the most important. And we cannot take oral glutathione. So this is a protocol that I've put together called, it's the Be Life protocol, B for Varughese, vitality. Go to my YouTube channel. So reversing diabetes and cardiovascular disease done through IV therapy, so we can give intravenous glutathione at high doses, not like in the spas that they do, but in actually really medically related doses, and high dose vitamin C. It's very interesting. The first speaker today, the physician section, discussed high dose vitamin C as a treatment for coronavirus, right? And as I was traveling here, I was thinking, I want to tell somebody that high dose vitamin C kills coronavirus or treats viral illness in general, and the first speaker talked about it. So high dose vitamin C reverses atherosclerotic plaque. That data was 30 years old data by Linus Pauling, showing how high dose vitamin C reverses vascular plaque. These are things we need to know. So glutathione and vitamin C together are in my IV protocol that we will be having in my clinic soon. And we can teach people around the world about that. Ribosine technology is very important. Ribosine is D-ribose and cysteine. So that comes in a pill form. Why? So that we can get it into our cells, teach the mitochondria to use the cysteine to make glutathione. Then we start making our own glutathione. Why? Because at around age 40, anybody less than age 40 here? Probably everybody. When we hit age 40, our mitochondria say, I'm sleepy, I'm tired, I don't want to make any more glutathione. So we decrease our glutathione production and increase our oxidation. And this is why we start hurting, can't walk, can't move, and then suddenly we have high blood pressure and diabetes and coronary disease and stroke. So we want to reverse that process. Oral ribosine helps to do that. And significant trials showing the benefit, about 23 published trials showing the benefit of ribosine in multiple disease entities of reversing disease. Superoxide dismutase, also another key player in the cascade of stopping oxidative stress. And there are oral ways of increasing your superoxide dismutase as well. And we'll be doing all of that in the clinic there. And EPA, very nicely talked about by one of the professors today to the doctors about eicosapentaenoic acid, which is in prescription form as purified EPA, which actually helps to stop the oxidation of LDL and triglycerides. So that's working on the pathways that we know and we talked about lipids, where EPA can actually stop oxidation of these things and then stop plaque progression and actually help with plaque reversal. So very exciting things, easy to do, just to see your doctor, and if your doctor doesn't know about it, then find somebody who does. Thank you so much for your attention. All right, I may have gone faster than I was supposed to. So